Hello and welcome to my channel. My name is Raza. I live in the vibrant city of Toronto, and for the past 25 years, Canada has been my home. Today is special. This is my very first YouTube video. So I kindly ask for your patience and empathy as I begin this journey. If I make small mistakes, that's part of learning. And I truly appreciate you being here. On this channel, I'll talk about real issues that affect our daily lives. Today, we are starting with something that touches every family in Canada: emergency room wait times. I'll show you why emergency rooms across Canada have become places where people wait, sometimes dangerously long, and what can actually fix these cases. Now, imagine you or someone you love arriving at an ER with chest pain and waiting for hours before seeing a doctor. That's not just frustrating, it could be life changing. In the next few minutes, I'll explain why ER waits are getting worse, what hospitals can do right now, and what government must change in order to fix these issues. All in simple, real world language with real experiences. First, a quick reality check. In Canada, healthcare is publicly funded. There is no large private pay emergency system, unlike in the United States where money can sometimes buy faster access. That means our public system must work well for everyone because we all depend on it. Now, before going further, I want to say something important. Our doctors, nurses, paramedics, lab teams, cleaning staff, and support workers hold the system together every day. Most of them are doing their absolute best under extreme pressure. So when we talk about problems today, remember the people delivering care deserve our respect and not blame. Now let me share my own personal experience. On my family doctor's advice, I went to an emergency room in Toronto. The hospital had already closed for walk-ins, but I was still assessed. I received an initial diagnosis, but treatment didn't really begin until 4 hours later. There were no beds available in that hospital. I was placed on a chair in a hallway along with other patients on chairs and stretchers. Nurses checked on me from time to time, doctors made their rounds. I could see the stress on their faces. I stayed in the hospital for close to about 22 hours. The wait was extremely difficult for me, but the care I finally received was excellent. This experience has taught me two things. First, our frontline workers need support. And second, governments must step up if we want timely emergency care. In theory, an emergency room has a simple mission: treat the sickest patients first, stabilize urgent cases, and save lives. And when the system is overloaded, delays grows. So let's look at real reasons emergency rooms are clogged. They are not rumors, they are not mysteries. They are system-level problems happening across Canada. Many patients in ER actually need to be admitted to the hospital, but there are not enough inpatient beds. So these patients stay in ER sometimes for many hours or even days. This is called boarding. Admitted patients occupy ER beds. The new emergency patients have nowhere to go. The ER slowly turns into a hospital ward, and the waiting room fills up. This is one of the biggest causes of long wait times. Canada, in my opinion, faces a real healthcare staffing shortage. Doctors, nurses, and paramedics are working long hours under intense pressure. Many are exhausted, many are burnt out, some are leaving the profession altogether. When fewer staff are available, each worker must care for more patients. That means slower service, longer waits, and more stress for everyone, including patients. Millions of Canadians do not have a regular family doctor. So when they get sick, even with minor problems, the emergency room becomes their only option. But ERs are designed for emergencies, not routine care. Non-urgent cases fill the waiting room. Truly urgent patients face longer delays. It's like using a fire department to fix everyday plumbing problems. The system becomes overloaded. Canada's population is getting older. Older patients often have multiple health conditions. They need more tests, more monitoring, and longer treatment. Each patient now requires more time and resources in the ER. When care takes longer per patient, everyone waits longer. While waiting patients occupy beds, beds stay full and new patients wait longer. Small delays at each step add up into major system-wide delays. Now, also during flu season, ER waits rise sharply. During heat waves, vulnerable patients rush in. During outbreaks like pandemic that we had in 2020, capacity is stretched to the limit. So these are not accidents. These are predictable system problems. And the good news is, when we understand the real causes, we can build real solutions. Hospitals can take actions right now. Rapid assessment zones, so patients are seen within minutes. Short stay observation units, faster lab testing and portable imaging, better bed management systems, nurse practitioners and physician assistants for minor cases, better schedules and wellness programs to retain staff. And in my opinion, these changes improve patients' flow quickly. Now, let's break this down a little further. Hospitals don't always need to wait for government policy to change. Many improvements can happen inside hospitals right now. The first one, like I mentioned, the rapid assessment zones. These are dedicated areas where a nurse and doctor quickly assess patients within minutes of arrival. This means serious cases are identified faster and minor cases are redirected quickly, reducing dangerous waiting room delays. Next, short stay observation units. And what I mean by this is many patients don't need full hospital admission. They just need monitoring for a few hours. By creating observation units, ER beds stay free for new emergency arrivals. Then the next one, faster lab testing and portable imaging. When hospitals invest in on-site labs and mobile X-ray or ultrasound machine test results, they come back faster. They are much sooner. Faster results means faster decisions, faster treatment, and faster discharge. Another key improvement, smart bed management systems. This is an innovative one. With real-time digital tracking, hospitals can see where beds are free, which patients are ready to discharge, and where bottlenecks are forming. This prevents admitted patients from getting stuck in the ER. Next, nurse practitioners and physician assistants. Highly trained professionals can treat minor injuries and illness without the need for a full emergency physician. This frees doctors to focus on serious causes, improving speed and safety. And finally, staff wellness and retention programs. Now, this is close to my heart. Better scheduling, mental health support, fair overtime policies, respectful work environment. Now, when staff feel supported, they stay longer and patients' care improves. Now, as you can see, as you can analyze, none of these ideas are futuristic. Many hospitals around the world already use them successfully. The tool exists, the knowledge exists. What's neglected is leadership and commitment. All right, so far in this video, we have reviewed and we have also checked to see what the hospitals can do, which I believe is within their authority. Let's quickly shift to the government, as they also have a responsibility. Governments can do something like increase hospital emergency rooms, train and hire more nurses and doctors, speed up licensing for internationally trained professionals, expand family clinics and urgent care centers, strengthen virtual care system, invest in mental health and home care. This is something very close to my heart. And also, they can take initiative to publish real-time hospital data. These investments protect both patients and the healthcare workers. Now, if you have visited an ER recently, you have seen staff working under extreme pressure with compassion. They deserve fair staffing, mental health support, safe working conditions, and respect. Supporting healthcare worker means better care for all of us. Emergency room wait times are not just statistics. These are real people waiting for help. Fixing this system is possible with smart planning and stronger leadership. And since this is my first video, I truly appreciate you staying until the end. Please be kind in the comments. I'm learning and improving with every video. If you find this video useful, please like, subscribe, and share your thoughts in the comments below. Thank you for watching and welcome to the start of this journey.